Hello and welcome to the Publicly Challenged Podcast. I'm your host, Luke Oswald, and I hope you join me on my quest for knowledge to become a better public land hunter, angler, and forager. Stick with this and who knows, maybe we will learn something together. All right, real quick before we get started on the show, I'm just going to talk about Treeline Academy. You've heard me say it. I can't even tell you how many times. Mark Livesey is treelineacademy.net. That's treelineacademy.net. Sign up. Use the promo code PC2020. Save yourself $20. Can't say it enough. It's awesome, amazing, most comprehensive e-scouting course out there. Check it out for yourself. Sign up. Use promo code PC2020. So I want to talk real quick about Basemap too. Basemap is an awesome tool to have in your arsenal to hold all your maps. They've got new offline maps now, so you can download them, keep them on your phone, and they operate 5 times faster than old maps did. So it's really great to download those ahead of time. That way, if you're in a place where you don't have a good cell signal or something like that, you still got your maps and you could drop all your waypoints and stuff with your GPS. I used Basemap all last season, and I can't tell you how much I like it over a lot of other platforms, especially their smart markers. I think it's really cool. You can drop those and get all kinds of data points that you normally wouldn't have just by dropping a marker on your phone. So that's really cool too. Use the promo code PC25. Save yourself 25% on sign up. Make sure you do it online on the website, not on the app though, because promo codes and discounts don't work on the app. So also I want to talk about my giveaway that I'm doing. I talked about it in episode number 65, but I'm also going to talk about it now. I'm giving away a spot to the Western Hunting Summit. Ryan Lampers puts it on. It's the Healthy Hunter, and it's a really cool experience. Brian Barney, Cody Rich, just all kinds of great people are going to be there sharing their knowledge with you about elk hunting, bear hunting, archery, and rifle hunting as well. So if you could send an email to Publicly Challenged at admin@publiclychallenged.com. That is admin@publiclychallenged.com. Or you can go to the Publicly Challenged website, and there is an email submission form that you can do right there on the website. But go do that, just one paragraph or longer if you feel you need to, but just tell us why you would want to go to the hunting summit, and or you can nominate somebody else why you think they deserve to go to the hunting summit, and we will get somebody going to that. So send that email and submit yourself or somebody else, and follow Publicly Challenged on Instagram, and follow the Western Hunting Summit on Instagram. And if you do that, when you send the email, make sure that you put your social media handle in the email so I can see that you're following Western Hunting Summit and Publicly Challenged. And with that being said, let's get to the show. Okay, so I'm sitting here and I am talking to Austin Lester. And Austin, last time I had you on the show, we talked about hunting with Eastmans, and we kind of touched on hunter preparedness and first aid medical type stuff. But being that the expert you are, I wanted to have you come back on and really dive deeper into the weeds on this, because I think it's something that most hunters are really kind of lacking. And, you hear all these guys talking about how, they're lightening up their pack as much as they can. Or, like I talked to somebody the other day and they were talking about how their med kit, or any kit, part of their kit, really, I shouldn't say med kit, but any part of their kit that they're just, if you haven't used it in the last 2 or 3 trips, take it out of your pack because you don't need it. And that doesn't necessarily go for when it comes to first aid. So I think you're the man to have on. And with that being said, can you go ahead and introduce yourself, man?
Yes. Well, thanks for having me back, man. I appreciate it. I'm glad I didn't scare you off with the first one. So yeah, man, my name's Austin, like you said, and I've been working with Fieldcraft Survival for the last couple of years now, and I'm the lead media dude, and I teach survival and I teach med for them as well. And my background it started actually when I was 17. I went through a EMT basic course. My mom signed me up for that. I graduated high school early and really had no true direction for where I was going to go or what I was going to do. I was looking at a few schools to go to college and maybe do something down that route, but school really wasn't my thing in the traditional sense. So she'd signed me up for that course, and she had been a neonatal nurse pretty much my entire life, and has been for 30 plus years. And so it had already obviously kind of bled into my lifestyle a little bit. And so I was like, all right, yeah, I'll check this out. Did EMT and ended up loving it. I had great instructors. I had a great group of dudes that I was in there with. And that kind of started me on my journey, learning about, in the medical field. And from there went on and went through the paramedic course and worked with a volunteer organization there as an emergency rescue technician with a volunteer organization to do VMR, which is like cutting people out of vehicles, and confined space, structural collapse, high angle rescue, stuff like that. So I started it and I loved it and found a lot of passion for it, and then ended up joining the military after doing that for a few years, and was able to be a part of a combat search and rescue team when I deployed, and got to do a little bit of the med stuff with that, but more so just the finding and plucking out of harm's way and bringing back. So I had my medical background though did help me tremendously in that, and I'll definitely say that of all the skills that I've learned and things that I've done, my medical training has helped me probably more than anything else.
No, that's awesome, man. And glad to have you on and talk about all that kind of stuff. So with that being said, like hunter preparedness, let's kind of, I think maybe go over kit first.
Totally.
And then kind of why you need those things. So like, I mean, you and I talked last time when we talked about tourniquets. I mean, that's like, it's huge, especially with hunters, sharp, pointy sticks, all kinds of, things that could go wrong. And so like, let's talk about, well, actually, let's just talk about total kit, and then maybe we can going into, you know what? I don't know. What do you think? Should we go into that, or should we go into like assessing stuff first?
Yeah, let's talk kit first, and then we'll and maybe I'll have a few stories that can kind of make it pertinent for people. As far as kit goes, and I understand I'm a hunter myself. I spend a ton of time in the backcountry. If I'm not at the office editing a video or teaching a class, I'm probably out in the woods, myself. I'm actually a member of the search and rescue team here locally in Utah where I live. And I spend a great deal of time with those guys and doing rescues here with that as well. But as far as kit goes, like you said, a tourniquet is usually the first thing I look for. If I couldn't have anything else out of a medical kit, I'm at least going to carry a tourniquet or two, preferably two, on me. Just because that is one of the leading killers of people in any circumstance. It's the number one killer on the battlefield is massive hemorrhage. And a lot of times that massive hemorrhaging can be stopped. And the reason that we develop medical kits, and medical kits are developed the way that they are, and we did at Fieldcraft Survival, is we followed literally the March algorithm. And I'm sure most people are familiar with it, but it stands for massive hemorrhage, airway, respiration, circulation, and hypothermia or head injury. And so using that algorithm, you carry as many things as you can to facilitate you taking care of all of those needs. Because those are the life-saving ones. Those are the super urgent things that you can make an intervention on and potentially save somebody's life, or at least prolong life to get them out of the backcountry into the back of an ambulance, or to an ER somewhere so they can have prolonged care. So tourniquet first and foremost. And then I also like to carry, again, following that algorithm, some type of an airway device, like a nasopharyngeal airway, an NPA. It's just like a long kind of rubber tube that flares at one end, and it's got like an angle, a bevel at one end. So that way you can slide it. It comes with actually most of them will come with lube. Yeah, some petroleum jelly or something. put on there so you can lube it up and put it in their nose. A lot of times I haven't even used that. I just use somebody's spit in their mouth and nice and wet and slide it on.
So, so let's talk about that. Like, I mean, because not your average person is probably trained to insert a nasal pharyngeal airway. And
Yeah.
I mean, it does take a little bit of skill and a little bit of practice. Now, have you ever been brave enough to administer one to yourself to practice?
So I either put one in myself or have a student put one in me every med class that I teach with Fieldcraft. Not because I enjoy it. It's not that fun. But because I think, and I have all my students that are willing, I don't force anybody, but everybody that's willing to kind of cowboy up and try it, I encourage them to try it on each other and to have one done to them.
So if you were going to give verbal direction, Austin, would you like put it in, right? And at some point you rotate and push
Yeah,
further.
so basically you're going to lubricate it with either spit or the lubricant that comes with it. And then that bevel is important. And you're going to align that bevel to where the bevel is facing the septum. So the pointy end of the bevel will face the septum or the center part of your nose between your two nostrils. And then you'll start sliding it in like that. And then as it starts to slide in and you kind of start to hit the back of the throat, you're going to kind of rotate that around. And you'll notice that kind of spinning it will help it insert a little bit better. As you really get to that last third of the MPA, you're going to notice a little bit of resistance, which is just where it's starting to meet the back of the throat, and that's usually the most uncomfortable part for the patient as well. If you're practicing on somebody that's not in some type of a medical emergency, you just breathe, you swallow, and you can get through it pretty easily. It doesn't really affect your gag reflex or anything that much. It's just uncomfortable, and then you kind of push on through, and then you'll get that to where the flared end rests just right around the nostril. And actually, prior to that, you should really measure it from the tip of the nose to the I'm not even going to use a technical term, but the little dangly flap on your ear. So
lobe, we'll call it the lobe.
Yeah, and so you can measure from there to there, and then you can cut and adjust it for size if someone is smaller. Typically, you'll see that with females or children, but they also come in a different diameter as well. So if you do get them and use them, you can either buy them in a kit themselves where they do have them already sized for smaller females or children, or you can just cut it down to size with a pair of shears or scissors or a knife. But if you do cut the end, obviously cut the end with the bevel and cut a bevel back into it. So that way it's not too long, which there's really, I mean, it would have to be a pretty dramatic length difference for it to really affect the patient negatively. Like I wouldn't want to put a full size NPA in, like an infant's nose or anything like that. One, it's probably not going to fit unless you force it. And two, then you can completely occlude the airway anyway. So just something to think about when you do it.
So what about like an oral airway?
You can absolutely use an oral airway. Typically for the untrained person, and oral airway or the OPA is a little bit more difficult to use. And it's a very similar concept, and all it's using and all it's doing, either one, OPA or the MPA, what they're doing is they're just sitting in the back of the throat, allowing the patient's tongue to not occlude the airway. And it's not what we would in EMS consider a definitive airway. Like it's not going to sustain life for a long period of time. But for someone that's unconscious, has been knocked unconscious or whatever the circumstances are, it's definitely a good tool to have in your kit.
Yeah, absolutely, man. So what else would you kind of want to include in the kit?
One of my next favorite pieces of gear to carry is a splint of some kind. My favorite is a SAM splint. And what it is, it's just a piece of aluminum, and it measures probably about 3 feet. I don't remember the exact measurements, but about 3 feet long and about 5 inches wide, and just maybe 1/4 inch to a 1/2 inch thick. And it's a piece of aluminum, soft aluminum that can fold and ply, and it's surrounded by a foam. And so that way it's just more comfortable. And it folds up nice and neat to where it's about a foot long, and like I said, about 5 inches wide down into your pack. It will come sealed in a plastic wrapper. But those things have a ton of great uses in the backcountry. aside from just being a splint. You can peel the aluminum off and take that aluminum and polish it up pretty good with like a little bit of grit from out of the river and use it as a signal mirror. I mean, you can turn them into a bowl and then even boil water in them. If you hold them up with water far enough, so they have multiple uses, but the obvious one being a splint, which is why I like to carry those. And I'll usually carry a couple of those depending on space and weight savings, which they weigh next to nothing. So it's not really a weight concern. It's just they're a little bit of an odd shape, but if you get creative, you can find some good spots to keep them in your pack.
So let's kind of circle back real quick when you mentioned tourniquet, because one, you said two, you would like to carry two. Now, does that go back to the philosophy of two is one is none? Or does that fall back on the fact that if you put one tourniquet on and it's not stopping the blood, add another one and potentially stop the blood?
Yeah, both. And that's an adage that I learned in the military, and I try to make that the case for most things. There's a few things you can get away with one, but if I'm carrying one, then I'm carrying it with an understanding that I'm okay, that if that one fails me, that it's not a critical piece of gear. So if it's something that I feel I really need, then I'm going to carry two to increase my likelihood of success. And a tourniquet is definitely one of those things. Like in my vehicle, I carry 4 tourniquets. I carry 2 within, really 3 of them are well within my reach. 2 really, really close, but 3 that I can get to just from a seated position in my truck. But in the backcountry, I carry at least 2. And usually we'll carry a rat's tourniquet as well, which is a different style than the North American Rescue cat tourniquet. The cat is the more familiar one. That's the one that everybody kind of knows and what it looks like and a general idea of how to use it. But the rat's tourniquet is a little bit different. It's got a metal buckle on it, a small U-shaped metal buckle, and then it's already pre-staged to an extent of it creates a loop for you, and then that loop will sit against the skin. You'll take the running end of the tourniquet, and it's an elastic material, it's like a rubber band elastic type material covered in like a cloth, and it stretches, has a good amount of stretch in it. But I'll take that running end of the tourniquet, run it around the limb, then I'm applying it, feed it through that loop, and then I'll cinch it down like that, and I'll pull all the tension and elasticity out, and I'll start wrapping that around the limb, and then it clips into that metal buckle and holds. There's a few different reasons for carrying one of those for me, and one of those is the cat tourniquet works really well for an average size adult male, most females, almost all females, and even some children. However, if you do have someone that's smaller, like a small child, a cat tourniquet is going to be too big. Also, the rat's tourniquet, I won't have that problem because I can cinch it down as tight as I need it. And also the rat's tourniquet is something that you can use on an animal as well. So something you could use on a horse, on a dog, a small child, whatever. So
the one thing like about the rats though, I mean, do you think a small child could actually put enough force on the rats to do it, like versus the torsion bar or the tension bar that's on, like the
windlass.
Yeah.
And that really is, when you look statistically at the data that supports tourniquets, the windlass is what is really the key factor in the success behind that tourniquet. And the rats doesn't have anything like that. It relies solely on that elasticity to work. And the other thing that makes a tourniquet really successful is its width. So, a cat tourniquet is a couple inches thick, and the rat's tourniquet is only about a half inch thick. So you have to stretch that, and then it takes a little bit more technical ability because you have to stretch it and then wrap it with end touching end to build that thickness. So it takes a little bit more technical ability, which is something that most untrained people won't be able to perform and do something like that under stress. And on top of that, it's something that can be difficult to do appropriately at night with no real good light. So definitely, those are just pros and cons in my personal opinion to some of those, but I definitely carry both.
So let's kind of get into like tourniquets and, like you can go on Amazon and buy a tourniquet, right? You
Hmm.
could even get like a 10 pack of tourniquets for $30, but
Hmm.
not all tourniquets are created equal. And let's kind
Absolutely.
of like break that down a little bit. Like if you were going to buy one, name the top three that you would buy or something like that.
If I was going to get a tourniquet, one, I'm going to do the homework. This is what you should consider a life-saving piece of equipment, because it literally is. You wouldn't go online and buy the cheapest handgun that you find, right? A lot of people are like, well, I want to get whatever's cheapest. Well, that applies with certain parameters, right? Like most people aren't going to go rock a high point in their, in their chest rig whenever they're in bear country, right? That's not what I'm going to rely on to save my life. I'm probably looking at that 10 millimeter, right, or 357, or something along those lines, and I'm not going to go cheap on ammo either, right? Like I'm going to pay attention to all those things. Well, this is no different than that. Don't just go buy the cheapest thing you see on Amazon. Like you said, not all tourniquets, not all medical devices or any medical equipment, they're not all created equal. So I would say the North American Rescue CAT tourniquet, the Gen 7, which is the newest one, is, in my opinion, the best tourniquet on the market. I've used the North American Rescue CAT tourniquets ever since I was in EMS, which I think then we were like on the CAT 2 or something, CAT 3. I can't remember what model, but they all have the same basic principle. They have a buckle, they have a windlass, they have a windlass clip, and then they have the body of the tourniquet, and then the tip, which is painted red for a specific reason. And it has an internal wrenching. The windlass actually spins a piece of webbing that runs the length of the tourniquet that's inside of a sheath, essentially. You don't see it, but it's what's actually attached to the windlass. So that's what allows it to be so effective. So when you put the Velcro, you run the tip through the buckle around the limb, you cinch it down as tight as you can, you feed all the Velcro onto the tourniquet, and then you begin to turn and twist that windlass. You twist it until the bleeding stops or you can't turn that windlass anymore. You slide the windlass inside the windlass clip, and then it has a timestamp piece of Velcro that goes over the windlass clip. That will, and it'll also be, you can hear it called a windlass retention Velcro or something along those lines. And you'll apply that over, that retains the windlass inside the clip. And then you write the time that the tourniquet was applied on that small piece of Velcro. But that internal wrenching webbing attached to the windlass is what really allows you to get that extra amount of pressure and tension around that limb. So it's completely proprietary. They spent millions of dollars designing that and getting it approved through all the appropriate channels. So that way they can say without a shadow of a doubt that this is the piece of equipment that you should be carrying. I've trusted those for many years. I've used them personally on patients that I've had and have seen them save people's lives. I hate saying that thing like, oh, well, I saved this person's life, but I've applied them to people and then they have lived because of that. And getting to a hospital and repairing that thing, So I'm not huge on just saying that myself, but they do work very effectively. And sure, there are instances where it may not stop the bleeding immediately. And in those cases, you may have to apply, and you should apply a second tourniquet, and then stack that on down. After that, I would say the soft T is another really good option. I've used them, I've carried them. I've never actually used one myself. I've trained with them. I've never actually applied one to a patient. But they work off of a very similar type technology. They just have their own proprietary twist. And then the materials that are used are different. Where the windlass has a synthetic, or I'm sorry, the North American Rescue CAT tourniquet has a synthetic windlass. The little wrenching, the little twisty on it is synthetic. The soft T has a metal windlass. So it's a little bit more of a robust system, and some people tend to like that a little bit more. But I've seen photos of the windlass breaking on a North American Rescue, but I've never seen that myself. And I've wrenched on some tourniquets. I do training just about every other week with these. I train on my own time with these. have used them and never seen a break.
So let's kind of talk about that as far as training goes then. So training with your tourniquet versus carrying it and relying on it to use, would you train with the same tourniquet? And now I don't mean train with the same type of tourniquet, the same exact one. Are you going to want to wrench on that and use it day in and day out and then hopefully rely on it for or do you want to carry a separate one for that?
Absolutely. I always encourage everyone to, and sure, it's a little bit costly. I think you're looking at $35 probably for a cat tourniquet from North American Rescue. But you should absolutely have one that you train with, and you should have however many it is that you decide that you want to carry. And I don't encourage anyone to train with a tourniquet and then carry it because there's just really no need for that unless you're just being a total cheapo. It's not that expensive. And two, it's just wear and tear on that piece of equipment, and that's not something that you want to fail. When you buy them, they do come wrapped in plastic with a little piece of paper in there with some patent info and a little bit of information about the tourniquet. I encourage everyone to open that plastic up, take out that little piece of paper, and then store the tourniquet outside the plastic in your kit, in your pocket, wherever it is that you're going to carry it. And so that way you're not trying to fumble around with a bunch of plastic when there's an actual emergency happening and you need that tourniquet. So have one to train with that you and your family take turns training with, and then have the ones that you're going to carry. And they do come in a couple of different colors. So the cat specifically comes in black, orange, and blue. And a lot of people like to get the black because it looks cool or it's not as bright. It's bright for a reason. Typically, people will train with a blue tourniquet, and then they know that's a training tourniquet. So that's how we are here at Fieldcraft. We'll train with blue tourniquets, so that way everybody knows, hey, these are ones that are being used in reps to have practice with familiarity with the equipment, how to use it. And then the orange tourniquets are the ones that we carry and we encourage people to carry because it's bright and contrasting and you can see it very easily. If I have a tourniquet on, I want someone to see that I need that help. Yes. So black was designed for law enforcement, military, to be able to put on in an environment like a non-permissive environment where they don't need something bright sticking out to be seen. That's why the black ones are there. And if you really want to carry a black one, carry a black one. But I personally, if I'm ever using one, I want to be seen having that tourniquet on.
So let's just say maybe on your chest rig, carry a black one, but in your hunter's pack, carry an orange one.
There you go. There you go. Exactly. And I get it. I get it. It's not that cool, but it's definitely one of those things where there's a purpose behind it. And it's just that little bit that most people just never really hear about.
So what else would you carry in your kit then? What are some other essentials that you definitely have to have?
So we've said tourniquet, we've said an MPA or some type of airway device, whether it's MPA, OPA. I've said a splint, and then I definitely like to carry some wound packing gauze, more specifically a gauze with a hemostatic agent inside of it or embedded within the material. And what that is a hemostatic agent essentially is just a fancy word for a chemical that promotes what's called coagulation, which is the body's ability to clot its blood. And whenever you use this gauze, it comes in a Z-fold. You may even see it called or labeled Z-fold gauze, but look for something that has a hemostatic agent inside of it. And why you would need that is whenever there's a puncture wound to certain areas of the body that maybe you can use a tourniquet on it, but maybe it doesn't necessarily need a tourniquet. Maybe it's not an indication of an arterial bleed or massive hemorrhage, but it's something that you could still pack to stop bleeding over a long course of time. Or it's in an area that you can't use a tourniquet on, like in a shoulder, like up kind of by your collarbone or something like that, or in a hip or something along those lines. You don't ever want to pack in the chest. You don't ever want to pack in the stomach as well, because that's an open cavity, right? You're going to pack and pack and pack and pack feet on feet on feet of gauze and never do anything. So it's used in areas where you can't use a tourniquet and it's not in the open cavity of the chest or stomach. But it's used, you create like a little, what we call a power ball on the end, where it's just, you take that material, you ball it up, and then you'll stick that ball and you'll stick your finger of your opposite hand that's holding the ball. So I'm right-handed, I'll stick my finger in the wound and find the source of bleeding, whether that's the actual vessel itself or at least where the most amount of blood is coming from. And then I will run that ball down next to my finger and wedge that ball right onto the source of the bleeding. And then I'll take the rest of that gauze. One way that you can do it is just toss it over your shoulder. And then you'll start to feed that down in with the opposite hand. So if I'm holding it with my 2 fingers on my left hand into the wound, I'm going to take with my right hand and start packing with 1 or 2 fingers on top of that and holding a lot of pressure and a lot of tension. And then I'll pull my other hand out, grab another bit of that gauze and stuff it down and continue packing now, one on top of the other until that entire space and cavity is full. And then I'll wrap that in another type of gauze or a bandage of some sort and maintain pressure on top of it after that. So I think a wound packing gauze with hemostatic agent is another great one. And it's really small. It's easy to pack. In most kits, I'll carry two of those at least.
So after you're carrying that, like Quick Clot or what would be your preferred? I mean, everybody probably, has their own, but I mean, there's like 2 major brands that I know of.
Yeah, Quick Clot's the one I'm personally most familiar with. I've used it quite a bit. We used it in the military. We had just gotten some by them when I was in EMS, and it's the one that I'm most familiar with. Most of those brands that are out there, you just want to make sure that it's from a reputable company. It's not hard to do the research on it. A quick Google search and you can find the top 3 companies out there that do it. But don't buy the cheap thing on Amazon that comes weird. You know what I mean? Like I said, this is all life-saving equipment. So take the time, do a little bit of homework, make sure it's a reputable company, and make your purchase that way.
Yeah, definitely. I think like the other one that I've seen and I've never personally used, but I have used Quick Clot on like just the powder, even the powdered Quick Clot on some cuts and stuff like that. But I think the other one's Celox or something like that, but I've never seen it or actually used it. I just seen it around. But so what would be, kind of some other stuff that you definitely should keep in there? I mean, obviously as a hunter, you don't want to get too heavy, but at the same time, I mean, this is saving your life.
And that's the nice thing about everything I've talked about so far, packs down pretty small. Everything, and I've got a few other items I'll mention, but everything kind of packs into a kit that's no more than probably 6 inches by 4 inches by 2 or 3 inches. Not taking up a lot of weight or space, not taking up much weight, and 100% worth carrying. So the next thing I would say is probably a trauma dressing. They come in a few different sizes. You can get them in a 3-inch and a 6-inch variant, and there may even be a few other sizes out there as well. But I like the 6-inch. It is bigger and puffier. The 3-inch is great if you really need those weight savings. But obviously the 6-inch is the preferred one. And all that is it's a bandage that it has a really thick gauze pad that's 6 inches long. It's about 3.5 inches wide, and probably an inch thick in one area. And then it has an elastic, almost like ace bandage type material for the rest, for the length. And on the very end of that ace bandage type material is a clip. And what you'll do is and this would be a great bandage to use after you use some type of packing gauze on top of a wound. You take that big, thick padded bandage and you'll put that right on top of it. And then you'll maintain pressure. You take that elastic material, you'll wrap it around that limb or wherever you're applying it. And you don't want to get it super tight, right? You're not doing it like you do the tourniquet where you get it as tight as you can. I'm taking this to where it's tight enough where I can slide a couple of fingers underneath that bandage, and that way they're still getting circulation to the rest of that limb. I'm not trying to completely cut off circulation because, again, I'm applying this on something that is not what I would consider massive hemorrhage. This is just something where I need to control the bleeding and then protect the wound. So I would put that on top, start wrapping that ace wrap around it. And then at the very end, you'll take that clip. And if you look at it just in a picture, you'll see kind of how it works, but it just clips over either side of the ace bandage and will stay put. You can even finish it off with there's some brands have a little piece of Velcro that'll stick to that ace bandage and hold it in place, or you can even take a piece of just med tape, surgical tape, duct tape, whatever you got, and tape it down. And then one other quick little trick with those is another thing that you can do is as you do a wrap, so I'll do a normal wrap over the bandage with that ACE. And then what I can do is I can twist the bandage once and put that twist directly over the spot that was bleeding. And what that does is as I twist one way and bring it around and then twist the other way, it begins to create like a little spot that creates a little bit more pressure, direct pressure over that one spot. So if it's maybe you've applied the wound packing gauze and then you've applied the bandage and it's still bleeding through just a little bit, you can apply that twist right over the spot that's bleeding and get a little bit more direct pressure out of that bandage as well.
That's a good idea. That's definitely a good idea for sure.
Yeah.
And anything else? Like, I mean, because one thing that I've used on a dummy, but I've never actually done it, and I kind of be afraid, is like a decompression needle.
Yeah.
Definitely not something you probably want to carry if you don't know what you're doing, right?
I would definitely encourage you, even with any of this, to get some training, right? I think med training is one of those things it's pretty widely available. Lots of places you can get it. Hit us up at Fieldcraft. We do it all the time. You know, we're training all over the country with it, and it's not super expensive. But a needle D or a decompression needle is definitely something. Is definitely something that I would encourage you to have some training on before you just took to using it. And more training than just a YouTube video, right? More training than just what I'm going to talk to you about in the podcast.
Right, definitely.
Because it's a 3.5 inch needle that is, I can't remember what gauge it is. I want to say it's
I know newer ones are a lot smaller than the older ones. I think they're like a 16 gauge or something like that. And
I want to say it's a 16 gauge needle. It's a pretty big needle, right? But what it's used for is you put it between, you know, the intercostal space and between a couple of ribs. What you're doing is reinflating a lung, and there are some indications that will bring you to why you would need to use a needle D, and it's kind of a deep subject to get into, but you know, there's definitely a training consideration there, because you can definitely do some harm using sticking a needle into somebody's chest, right? But it is a good piece of gear to carry because it's small, it's lightweight, and it has a huge impact on the outcome of a patient if it's done appropriately. But that's kind of the key phrase, is if it's done appropriately. So
is there anything else in the kit then? Because I
think the last few items that I personally would encourage you to carry is a pair of trauma shears, just so that way you can, one, cut bandages, but two, also expose injuries from a patient or a victim, right? So, you know, a lot of people joke and have said, oh yeah, if you're in a situation where there's been trauma, you get what they call trauma naked, right? Where medics are going to show up and cut all your clothes off and you'll be laying there naked. Well, that's somewhat true. That's partially true. And the reason that is one, you can't treat what you can't see. And so you have to expose an injury to actually properly treat that injury. And, but there is a too far point with that as well, right? I don't want to expose somebody out, you know, wherever I am, no matter the time of year, and cut all their clothing off. Like, I'm going to cut just enough to expose the injury, be able to treat it, and cover them back up. And there's a few reasons for that. One, their dignity. Don't just cut somebody's clothes off just to do it. But two, when someone loses a lot of blood, your blood is what keeps you at 98.6 and what allows you to sustain life at the proper temperature. When you lose a lot of blood, you can fall into what's called secondary hypothermia. And what that means is you've lost enough blood that your body starts to significantly cool off. And it doesn't matter. It can be 105 degrees outside and they could be laying on the asphalt and still suffer from this. And it's actually a very common thing that medical providers deal with, especially paramedics and EMTs on the street deal with. They have to fight that because it happens very frequently. And there's a few statistics out there that are pretty alarming with it. And I can't remember the exact numbers, so I'm not going to try to tell you what those are, but they're very high. And there's several, a lot of patients show up to the emergency room hypothermic due to that. And most of them that show up hypothermic end up passing away because it causes several other issues within the body whenever you become hypothermic. So don't just cut somebody's clothes off because there's an injury. Expose the wound, treat the wound, and then cover them back up and keep them warm and treat for shock. Also, I would put a blanket in there, like a survival blanket of some kind, which is just that shiny material. Everybody's pretty familiar with seeing them. Usually they're bright orange on one side. They have that reflective material on the other. They pack down really small. They're easy to carry. And you can cover somebody up with those and help promote warming them up and treating for shock. And then lastly, I would say I encourage some tape and some gloves, some nitrile gloves. Rubber gloves are kind of a thing of the past. Most glove companies that are making gloves are producing them in nitrile, which allows you to not have to worry about someone that would have an anaphylactic reaction or are allergic to rubber. Nitrile is one of those things that's pretty universal that you don't have to worry about that with. And the gloves aren't just because, ooh, gross blood, right? Like, it's not like, oh, I just don't want to get blood on my hands. And it's not just for, oh gosh, I don't want to catch whatever they have. Because even if I'm working on a friend of mine that I know very well and I don't have to worry about any disease or anything crazy that I could catch from them, it's just a thing of hygiene, right? I don't want to be treating an injury, especially something that's a deep puncture wound or a deep laceration or something, with my nasty, grimy hands, especially if I'm out in the backcountry where I have God knows what all over my hands. Just put your gloves on, treat the injuries, because especially if you plan on spending any amount of time in the backcountry, more than a day or two, you can get infection just that quick, and it's very dangerous. You can end up with all kinds of issues, cellulitis and all kinds of issues where that can be life-threatening, and especially with the consideration of being in the backcountry. So just carry a pair of gloves and wear those if you're going to, even just little nicks and scratches, just wear a pair of gloves.
Yeah, for sure. Plus, I mean, the stuff under your fingernails, like you said, just every little thing. But
Yeah.
with that being said, let's talk about now that we talked about all the tools and what to carry and kind of a little bit of how to use them, let's talk about like identifying and when to use them.
Yeah. So one of the biggest things is an assessment. And where I grew up doing EMS, a big thing was assessments. They really sent that home with us, because you can't treat what you can't find. And you're doing a disservice to whoever it is that you're trying to help by not doing a proper assessment. And you can see a lot of what we would call distracting injuries. And what that means is, if you come up to a car accident, there may be somebody, and I'll just go and I'll be the guy that gets dramatic, but just for the example of the point that I'm making, you come up to a car accident or somebody that fell, and they could have a broken arm, right? If a guy falls out of a tree stand, that's a pretty significant distance to fall. And we look at falls greater than 10 feet to be something to be very urgent with, because there's a lot of room for injury there. But you could have a guy that falls and he fell on a stick, but his arm is broken and is sitting at a 90-degree angle. And that's a very distracting injury, right? Like, he's probably looking at it, he's freaked out, you're freaked out. But what you're not paying attention to, because you didn't do a proper assessment, is the stick that stabbed him in his leg and punctured his femoral artery, and now he's bleeding to death. That arm, as long as there's no major bleeding there, isn't going to kill him. It's just a broken long bone. It can be fixed and it can be reset, and he'll be totally fine from that. But it is very distracting. It's a very painful injury to have, but it may not be the injury that's going to kill them the fastest. So you have to do a proper assessment to pay attention and see what is happening with a patient, so you can treat what's the most urgent then to the least urgent, if that makes sense. So there's a few different ways of approaching an assessment. And the first way of doing it is, say you witness, and we'll just run with the tree stand example. You see your buddy going up the tree in his tree stand, something goes wrong, something breaks or whatever. He falls 15 feet out of this tree, lands, thumps his head, lands in a pile of sticks, and he's unconscious. So he can't even tell you what's going on. Well, you run over to him, and the first thing that you need to pay attention to in an assessment is not only an assessment of your victim, but an assessment of the surroundings. Is this area safe for me to actually be in? Because if I run in there and get jacked up myself, I'm not doing anybody any good, including myself. So I need to make sure it's safe. So what I'm going to do is I'm going to make sure, well, is the tree stand going to fall down when I bend over to help him and knock me out too, right? So maybe I just take a look up in the tree, and if I need to do something, and I can do something quickly to get that tree stand down to where it's not going to fall and hurt me, then that's what I need to do. Or whatever the scenario may be, I just need to make sure it's safe. And then after that, I'm going to approach whoever it is and try to talk to them. Hey, man, can you hear me? Do you understand anything that I'm saying? And assess their level of consciousness, see if they're awake, see if they're completely out. And after I've assessed that, I'm going to look at all the things. I'm going to run through that algorithm of March, massive hemorrhage, airway, respiration, circulation, and then hypothermia or head injuries. And because the reason for that algorithm in that order is those are typically the things that are going to kill someone the fastest. So what I'll do is I'll start with a blood sweep. And what that means is I'm putting on some nitrile gloves. I'm starting at their head and I'm sweeping their entire face and the back of their head without moving them dramatically, their ears and everything for blood. After I cover the entire face and head, I'm looking at my gloves, looking at front and back to see if I see any blood on my gloves. One other quick tip with gloves is a lot of people are quick to want to buy, similar to the tourniquet, they want to buy black gloves because they think they look cool. Guess what doesn't show up very well on black gloves? Blood. So get blue gloves, get some tan. I know North American Rescue sells tan gloves in most of their kits, or white gloves. Just get the brighter colored gloves so you can see blood on them. After that, I'm going to move to the neck, check the back of the neck. And again, I'm not moving their neck and their head around like crazy. I'm just feeling around it and then looking at my hands, see if I see any blood. Check the front, the throat, and then I'll move down the collarbones, down the shoulders, down one of the arms, then down the other. And again, every time I touch a body part, I'm looking at my hands. So I'll sweep one arm all the way down to the hands, look at my gloves. I'll go to the other arm, I'll check the other one, look at my gloves. Then I'll go to the armpits, look at my gloves. Then I'll start with the chest, check the whole chest, the back as much as I can get to it, stomach, the pelvis. Again, being very careful with the pelvis because if there's an injury there, the pelvis can be unstable. If I move it around too much, bone shards that may be inside there could nick the femoral artery and cause internal bleeding. So I want to be careful with the pelvis. And then I'm going to check both legs and the feet to see if I notice any bleeding at all. If there's none noted, if I don't see any major bleeding or anything on my hands, then I'm going to move to the airway. And I'll go up to him. And again, I'm trying to see if he's awake, if he's going to talk to me. Maybe he's moaning and kind of out of it, seems sleepy almost. Well, I'm just going to look at his airway. And I can do that by just look, listen, and feel. And a lot of people are familiar with that just from CPR, where I bend down, I put my ear close to his mouth. I'm looking down his chest and I'm listening to see if I hear any breathing. I'm trying to feel any breath on my face. And I'm looking for any rise and fall out of the chest to see if he's breathing. If he's breathing normally, which is anywhere from, about 20 respirations a minute, anywhere plus or minus there, which is going to be on average, then continue on with your assessment. If he's not, or if he's not breathing at all and is completely unconscious, then I'm going to go ahead and put some type of an airway device in. And that would be the time to make that intervention. So I'm going to put my MPA in, just like we talked about earlier, and put my OPA in. From there, I'm going to, and that's where I'm assessing the airway and his respirations at the same time. And that's something that I want to go ahead and take note of if I can. So having a pen and paper or a Sharpie most med kits will come with a little mini Sharpie inside, which is great for writing on the tourniquet. And also you can just take notes on the back of your glove or on the back of your hand or on your pants. One thing I used to do is rip off a piece of tape and put it on my leg. And I would write down all my patients' vitals on that piece of tape. So that way I had it there and referenced them so I could get back to my clipboard and write it down on a piece of paper. Well, obviously we're not going to have a clipboard and a piece of paper in the backcountry, so just writing it down on my glove, on the back of my hand, on a piece of tape or my pants leg, whatever. And then just take note. And the reason taking note of things like that is so important is so that way when I go back and I reassess later, or maybe the paramedics show up or someone shows up, I can tell them, hey, he was breathing, 15 times per minute, 20 minutes ago. Well, if he's now breathing 4 times per minute, something has changed in that amount of time and can actually clue in the emergency medical providers or a doctor later on. So taking note of those things is really important. So write that down. If you have that ability, or jot it into your phone. Most everybody has their phone, you can put a note in. From there, I'm assessing his circulation. So I'm just going to check a pulse. You can check a carotid pulse right there on the neck. It's kind of a difficult thing for me to explain, but I would venture to say that most people have checked their pulse on their neck, in the carotid artery a time or two. And again, check it, make sure it's there, and assess some details about the pulse. Is it really, really strong? Is it like thudding really hard? Or is it really faint, really difficult to see? Because those can cue you in, and maybe not even you, but a medical provider later, into some things. So take note of not only how many times it's beating per minute, but what does it feel like? Is it a really strong, normal pulse? Is it beating really, really fast? Is it beating really slow? Is it faint? All those types of things matter. So one thing you can do is just take note for 15 seconds, especially if you notice that there's some serious trauma involved. Take a 15-second pulse or a 30-second pulse, and then for 15 seconds, obviously multiply it by 4. For 30 seconds, multiply it by 2, and then you have a solid number for what a BPM would be, beats per minute. So from there, I'm going to start treating that person for hypothermia, and I'm going to start looking at head injuries. So what I'm going to do is get out that shock blanket or the survival blanket, and I'm going to get that out, and I'm going to lay it over them and start protecting them and keeping their body temperature warm. You want to keep them warm. And that's because any type of shock, whatever it is, that's the best treatment that you can do. If there's no significant trauma to their hips or legs, you can raise their legs and bend their knees, which will help shunt blood back to their trunk or to their heart, and help treat for shock that way as well. If you have the ability to, and there's not a ton of trauma or anything that would prevent you from moving them, go ahead and get them off the ground as well. Put a sleeping bag under them, put a sleeping pad under them, something like that. Getting them off the ground will help a lot as well. And then again, I'm going to start looking for head injuries at the last part of that assessment. And a few signs for that is looking behind the ears to see if there's any bruising behind the ears, which is called battle signs. You can look under the eyes, and you'll see, like, we'll call it raccoon eyes, where you get bruising right underneath the eye, like the same you would as if you had like a black eye, or any type of clear fluid coming out of the ears or the nose, which could be spinal fluid. And the bruising under the eyes will cue you into some, like, a significant trauma. The bruising behind the ear, same thing. So that'll cue you into some significant head trauma. And obviously there's not a lot we can do about that as a first responder, but it's important to take note of, to tell, so that way they can relay that to the doctor, so they can start making the interventions that they need to make. So following that protocol, looking for those things and making interventions at their appropriate points, that's really important for an assessment. If at any point during my blood sweep I do find blood, maybe I find it on the leg, but I don't really see a hole in the clothing, or the clothing's not overly ripped or anything crazy. I'm going to find as best I can the source of that bleeding. I'll get my trauma shears out, and I'll cut those pants, and I'll try to expose that injury and see what it is. So that way I can actually know what's going on and can treat it. A lot of people take, they see in a video, or they hear through whatever it is, they hear, oh, well, an arterial bleed, that's going to squirt bright red blood. Well, that's true. It will squirt bright red blood. But if we're wearing multiple layers of clothing because we're out hunting, or even a single layer of clothing, it doesn't mean that it's going to be squirting out of that person. Clothing does a really good job at hiding all that bleeding. So we need to make sure we expose the injury so we can actually see and assess the amount of bleeding that may be there.
So one of the things you mentioned about putting, retaining the heat and stuff like that, putting the pad underneath them. Can we kind of go into that a little bit more too, as far as, like,
Sure.
I mean, you talk about hypothermia, but, like, what types of hypothermia are there, and how do you lose that body heat?
So one of the things that we teach, and I'll start with it like this, and one of the things we teach in survival, and I'm stealing a method that Kevin Estella, that I learned from Kevin Estella, and it's called the IOU method for building a shelter, which is something to sleep inside of, something to sleep on top of, and something to sleep underneath. Those are the principles that you should be following for building a shelter, in an emergency type shelter, or any kind of shelter really in the backcountry. that I plan to survive out of, even if it's for one night or for a long period of time. If you can make something very similar to that for a victim in the backcountry to treat for shock, it's a huge thing. Get them on top of something, get them off of a cold ground, put them inside of something if you have a sleeping bag, or you can cover them. I wouldn't suggest necessarily putting them inside the sleeping bag. I would maybe just drape the sleeping bag over them. So that way I can always go back and look at any interventions I made. When I say interventions, that means applying a bandage, applying a tourniquet, putting in an airway of some kind, any type of thing that I did to that person, I consider that an intervention that I've made. So I need to be able to expose those interventions and the things that I've done so I can assess them, in 5-minute or 10-minute increments, so I can see if things are if it's doing its intended purpose, if it's stopping the bleeding or if it's continuing to bleed and getting worse. So don't necessarily make it difficult to get back to those interventions, but drape something over them and keep them warm. There's several different types of shock, and hypothermia is essentially just hypo meaning low, and then thermia is just your temperature. So that's any time that the body is really dropping below about 95 degrees, the core body temperature. When you're cold, probably at the coldest you've ever been in your life, where you're shivering and you're like, oh my God, I got to get inside. Your body temperature sits at 98.6. You're probably at like 98.1, and that's at the coldest that you're ever getting. So maybe, you're getting down into 97.9 or something like that, but you're not having like an entire degree difference change when you're just cold. So your core temperature has to really drop for your body to be in what's truly hypothermia. Typically, it's something that takes a long amount of time to happen from an external factor. It doesn't just happen immediately, depending on the external conditions, right? But when we're talking about blood loss, you can lose a significant amount of blood very quickly through an arterial bleed. If you're able to identify and stop an arterial bleed, we don't have means as just first responders and civilians to put blood or any type of fluid back in the body. So the only thing that we can really do to promote that and help our victim out is to keep them warm and try to keep their body temperature high. And I can give you a little bit into the weeds on why that's so important. And it's something that we're battling, and it's called, oh man, it just escaped me. I was about to tell you. Oh my gosh.
So the keep them on the mats. You're preventing conduction, right? You're
Yes.
keeping the cold ground or something from sucking the heat out of their body, especially when they've already had a blood loss. So
Absolutely.
that way you're keeping their core warmer if it's already starting to drop because of the blood loss. Now you're preventing that conduction, sucking the heat out.
Mm-hmm.
And then there's some other means that also, heat loss through perspiration or moisture evaporation, right? Where you're trying to prevent that by covering them up, so that way they're not either losing that heat through evaporation, or if their skin was a little wet or something like that, you want to trap that heat. And then what would the other one be as well? I mean,
There's a few different types of heat loss. Evaporation, which is the one we all know. You sweat and it begins to evaporate up off of you. Convection, which is just air moving across the skin, and can be lost just through your, the ambient air and being an environment that's cold, which is why you want to put them inside of something. And if that just means pulling them out of the environment as best you can, putting them inside the tent, something like that. There's conduction, which you touched on, which is just laying against an object. The colder object will always cool you down. You're never going to just heat up whatever you're laying on. There's radiation, which is just your body radiating that temperature. Even if that's just, if you had a block of ice next to you, right? That's colder than what you are. So you notice that, right? Well, our bodies work that same way, and we radiate heat and can lose heat through that. And then respiration, just through our breath. As we breathe, we release moisture and all the oxygen, and it can cool us off. So putting them in a warmer environment where they're not inhaling a bunch of cold air is another great reason just to put them inside of something to help keep them warm. The term I was looking for a second ago is the lethal triad. There it is. Good grief. And what that is so hypothermia is one of those pillars of those three pillars. So as you become hypothermic, it affects your body's ability to coagulate blood, which I mentioned earlier. Coagulation is just your body's ability to clot. So as you lose the ability to coagulate blood and you lose more blood, it affects your body's pH balance. Being more acidic or alkaline affects the way your body performs in a lot of different ways. You notice after you work out, you're sore the next day. That's because you've built up lactic acid, and that acidity can affect you in negative ways if it's not dealt with, like by stretching. It can make recovery much more difficult for your muscles, right? Well, you can imagine how being overly acidic or overly alkaline, which is less acidic, can affect your body in other ways internally, right? Well, as your body loses its ability to balance its pH through blood loss, well, you're not able to clot that blood, right? So then if you can't clot blood, you lose more blood, so you continue to get colder. As you get colder, your pH balance continues to get off, and then you fall into not being able to coagulate even more, and so now you're losing more blood. You can see that that's kind of a perpetuating cycle, and one affects the other. So you have to stop one corner of those pillars to be able to stop that lethal triad. So the one that we can really affect change on is I can't affect your body's coagulation, your ability to clot. I can't affect your body's pH balance in a short amount of time as a first responder, but I can potentially stop all that bleeding and allow your body and promote staying warm by putting you inside of, on top of, and underneath something.
So with that being said, good reason to carry some type of clotting device of, your gauze or whatever, circling back to what we talked about earlier, and a tourniquet, and also your mylar blanket or space blanket or whatever you want to call it as well.
Yep. And then a sleeping pad works great. Any kind of a tent, or one of the big ones that I always carry is I carry like an old school poncho. I have an old BDU poncho, and I was issued it when I was at the survival school for the Air Force. I was issued like 10 of those things, and I still have them all. And when I got issued them, I was like, oh my gosh, like this is like some Vietnam era stuff. Like, what are they giving us this stuff for? But dude, those things are awesome. I carry at least two with me almost all the time, because again, two is one is none. And I just like them, man. Like, one, they work as a great poncho, but I build every shelter I've ever stayed in the backcountry has been one of those ponchos.
I carry one in my trunk of my car, and mostly use it as actual rain gear, but I know there's other uses for it, in some type of survival scenario or whatever.
Mm-hmm.
But there's no way in heck I'm going to carry one of them into the backcountry in my pack. Not when you can carry 2 or even 3 or 4 or probably 10 mylar blankets realistically.
Oh yeah.
Before you even get to like a quarter of the weight of that thing.
Yeah, absolutely. And I think I carry them for nostalgia purposes.
Yeah.
And it's like a sense of pride to me to still make a shelter out of them and do my thing with them. But dude, something even like that, or a tarp, or, like you said, the space blankets, there's a million options out there, and way better options. I mean, you can carry a tent that weighs ounces now. You know what I mean? And something as simple as a few ounces of a tent can make a huge difference in treating for shock of whatever kind.
So is there anything else as far as like identifying or anything? I mean, we kind of covered it mostly, but
so the other thing I would do is after I've done a blood sweep and check to see if there's any bleeding from any part of the body, is you can go back and actually do like a secondary assessment on your patient. And this is a little bit into the weeds, but I'll give you guys an acronym of the things that you can look for. And what it is it's called DCAP BTLS. And I just memorized that. I was taught that in the EMT course, and then I just remembered what it stands for. And it stands for deformities or discoloration, contusions, abrasions, punctures or penetrations, burns, tenderness, lacerations, and swelling. So those are all the things, and obviously that's a lot of things to look for, right? Especially in one sweep, especially as someone that's not necessarily doesn't hold a credential of actually helping someone, right? To be an EMT or a first responder or a paramedic or anything like that. But if you can memorize that and at least remember some of those, you know what you're looking for. So then again, I'm just going to start over at the head, and then I'm going to get really hands-on. So I'm going to be feeling around, my patient's forehead and on his skull all the way around the back, and feeling, the orbital bones around the eyes, and feeling the nose to see if the cartilage is all intact, and around the mouth, and opening the mouth and looking to see if there's any teeth missing or anything crazy that could obstruct their airway. I'm going to feel down their jaw and then move to their neck. I'm going to feel on their throat, their Adam's apple, and make sure everything feels somewhat normal. Feel their collarbones, make sure there's nothing there that sticks out to me as any of those decap BTLS type things. And then I'm just going to do that and follow the same pattern that I did for the blood sweep. I'm going to go down one arm, but I'm just being a lot more hands-on, where I'm actually gripping and feeling those bones and the muscles, and squeezing and pulling and moving. And I'm not going to be overtly aggressive or anything, but what I'm doing is I'm just trying to see if there's any kind of reaction out of my patient. And even an unconscious patient will react. Even someone that's completely out cold, if you grab a hold of their arm and it's injured pretty badly, their body will tense up and they'll wince. So obviously I don't want to do it aggressively enough to create more and cause more damage, but I'm just trying to get a reaction, right? To see if there's anything there. And even as a conscious person, if you've just been through some type of traumatic event, like a fall or a car accident or something like that, you may be shook up and not even notice an injury that's happened, or you may not notice another injury. Like I said, if you have one of those big distracting injuries, like a really badly broken arm or something like that, you might not notice that your foot's broken too, but it's important to take note of, so that way it still gets taken care of.
No, it's funny you say that, because I actually kind of run through the gamut of that acronym about once a week with my son. He's he's not quite 2 yet, but he likes to climb a lot, and you literally turn around and he falls off of something or whatever. Most of the time he's okay, but you start to notice, like, every once in a while he'll wince or do something, and that's when I run through the full assessment and you start
Yep.
squeezing the appendages and looking
Yep.
for bruising.
And that's the thing, is a lot of parents are masters at this, and they don't even, because you're just trying to figure out, well, what the heck did you do this time,
Yeah. So I've got a little bit of experience in that, but one of the other things I think is huge is backcountry communication. And I know a lot of people don't think about that, or they use their cell phone, but most of the time, let's be realistic, we're going to places to get away from, society, right? And a lot of times you don't have cell service. And the one thing that I throw in my pack, super simple, you keep it in your truck, you keep it charged. I keep it in my truck pretty much all the time, is like some type of satellite communication, whether it be an inReach or whatever. And you can do all kinds of subscriptions to where it could literally be, I think, like $5 a month.
Right.
And you think about it and you're like, oh man, $5 a month or even $10 a month. You're like, oh, I don't want to do that. Right. But you'll go to Starbucks and go through a drive-through and buy, 2 cups of coffee a week or whatever. That's just paid your subscription for that device that could potentially save your life one of these days. And I've never had to use it, but I will say the other thing I think super cool about them is when I I could just send a message to my wife, like, hey, I'm out in the field, whatever, or, just got to the stand.
Yeah,
But
I'm
when I
going to be out
do
here
that,
another night, or I'm going to be doing whatever,
but the cool part is when I do that, it actually pulls up a map to where she can click on her phone, and that's my last known location as well.
Yeah.
So it's pretty cool.
That's awesome. Yeah, and that's huge, and having some type of even if you don't have a Garmin inReach or a Spot. I carry a Garmin Spot with me, and I have an inReach that was issued to me through Search and Rescue that I carry, and it's a great device. It's amazing, and I would encourage anyone that spends any amount of time in the backcountry, even if it's just for a day hike, to carry something like that. And yeah, sure, it is a little bit of money, sure it is commitment, but the security that it gives you is insane, and it's actually, we deal with this a lot in search and rescue, where the guy will, whoever's out there will call 911, and we'll get some type of a triangulated position on kind of about where they're at, but it's accurate to really a couple hundred meters. And so we're getting out way somewhere out in the backcountry, and here in Utah, we see a lot of people that
at this time of year doing, on snow machines, and they're out, 8-10 miles into the backcountry on a snow machine, and it breaks down and the sun starts going down and they're exhausted because they've been working on their snow machine, or they're stuck and they've been working for an hour to get unstuck and they just can't do it. And they're starting to get cold and they're sweaty. And they call 911 and they're like, hey, I need help. So, we'll take off out there, but then it's a search, right? But every time we've gotten a call out where we've gotten an in reach signal, it takes us within 5 meters of that person's position. A lot of times it's down to like 3 meters. So it's very accurate. And it's just so much easier to work with. And whenever the 911 service locally gets that, it's almost always an exact location of where that person is versus trying to triangulate somebody's cell phone off of a few cell phone towers that might be miles and miles away. So it's just a much more accurate, a much more urgent way of getting your exact position. And so I can tell you firsthand that something like that is way helpful, even for the parties coming to get you.
And that's even Forlow. I know a lot of other clothing companies have done it, as far as like at BCA and some other people. They put the Rico technology
Mm-hmm.
in their clothing. And actually, I talked to Andy, quite a few episodes ago, but the owner of Forlow, and they decided to put in the hood of their jackets the Rico technology.
That's
So
awesome.
it's got the repeater, repeats that signal back to them. So that's a huge help too.
That is huge, man. And I think that's super smart, especially in avalanche country, right? Where you need someone that is going to have a probe, so that way they can be found much faster. And I would encourage everybody, and I just did a video, like a 20-minute video on my Instagram on things to carry for if you're going to be spending time in avalanche country. But I would encourage everyone to get not just a probe, but not just a receiver, but a transceiver, something that can send and receive a signal, because it might not just be you. If you're out there, usually people take 1 or 2 or 3 or a handful of friends with them on snow machines or out into the backcountry skiing or whatever. And should you find yourself in that worst case scenario of being caught up in an avalanche that you can't avoid, you're going to want to be able to send out a signal to find your friends and start working on getting them out. Because I can tell you that a lot of times in a lot of places in this country, help is very often a half hour to an hour and sometimes even longer away. And that's if they're fast. I'll say here in Utah, I'm not far from Park City, and that's one of the biggest skiing areas in the country. And we're very fortunate to have to be funded well and have some really good guys that are really experienced on our teams, and we're really good. We have really fast response times. But I know in areas in Washington and Idaho and things like that, their search and rescue times are much slower because it's a volunteer service. It's it's maybe a step above the Jeep posse, and that's just all that they have in that area. And that's no fault of their own. And I don't mean to say anything negative towards that at all, even a little bit, but it's just the reality of the situation. So a lot of times help is several minutes to hours away. So having that technology and clothing and carrying it on your person, it's massively helpful.
Absolutely, man. I appreciate you coming on and talking to everybody about all this stuff. I think it's super important, and I'm glad we got to sit down and definitely talk about it. So
Yeah, I
once
appreciate
again,
it.
dude, yeah, before we go, man, tell everybody where they can find you, where they can find, sources maybe that you referenced on top of, the company you work for, man.
Yeah, absolutely. So I appreciate letting me come on. Hopefully I didn't bore everybody to death with all this. It's not the most fun and sexy of information, but it's life-saving. So I appreciate you having me on again, and would love to come back. But you can find me on Instagram at Savage Lester. And then I work for Fieldcraft Survival. You can find us on Instagram at Fieldcraft Survival. You can check out our website. Check us out on YouTube. We do tons of free content on YouTube. We're putting out 2 videos a week on YouTube right now, and sometimes even more. And then you can find us on a platform called Locals as well. It's a paywall, $10 paywall, but we're putting several videos a week of very organized content on that platform. and everything from tactical training to survival training, and a lot of what we talked about tonight in med training. And it's not just from me. We have another guy in house whose name is Doc Pete. He's a Green Beret. He's a doctor. And I mean, he's the real deal. You know what I mean? So we have him on there giving out tons of free content as well on all this stuff that we talked about. So there's tons of other great resources out there. North American Rescue, follow them on Instagram. They have tons of great videos. Dark Angel Med. I mean, the list goes on. You can get on YouTube and Google any of the things I talked about and find some source of information. But I would absolutely encourage you guys to get out there and research these topics and learn about them. And check us out, like I said, at Fieldcraft, man. We do courses all over the country on this stuff. I'm teaching one in 2 weeks. I'll be out in Connecticut teaching. I'll be down in South Carolina teaching this stuff. So we're all over doing this. So I definitely encourage people to get out and do it.
On top of that, you can go to Fieldcraft Survival and jump on their store and probably purchase pretty much anything that we've talked about as far as gear.
We have all those kits. We have big kits online. We even have one, the Hunter kit, that's designed to be lightweight. It carries all the things that I mentioned. It weighs no more than a few ounces, and it's camouflage on the outside, just so it's outside of your pack, you know. So we really thought it through and are trying to put out the best products that we can for you guys.
All right, man. Austin, I appreciate it. Like I said earlier, man, thank you so much for coming on. Thank you for sharing.
Thanks, brother. Appreciate you.
And once again, thank you so much for listening to the Publicly Challenged podcast. I hope you enjoyed the show, and if you did, please subscribe on whatever platform it is you're listening to. Also, if you could leave a review, that would help us out. And you can check us out on Instagram or at publiclychallenged.com. And once again, thank you so much for listening to the show.